Hello, I'm Mary Merrill. I'm a registered nurse here to help you learn about the FlexiSeal Fecal Management System, also known as FMS. FlexiSeal FMS is a temporary containment device indicated for bedridden, incontinent patients with liquid or semi-liquid stool. It was designed to safely and effectively divert fecal matter, protect wounds from fecal contamination, reduce both the risk of skin breakdown and the spread of infection. Understanding how FlexiSeal FMS works and how to properly use it will enable you to bring to life all the benefits that this system has to offer.
FlexiSeal FMS consists of a silicone catheter, syringe, and collection bag. At one end, the soft silicone catheter has a retention balloon that is inserted into the rectum. At the opposite end, the catheter has a connector for attaching the collection bag. The catheter diverts fecal waste away from the patient and facilitates the flow of stool into the collection bag. Two small tubes, each with a port, are attached to the silicone catheter. One port with 45 ml printed on it is used to inflate the retention balloon after the device has been inserted into the patient's rectum. It is called the inflation port. Another port with IRRIG printed on it is used to flush the catheter if it becomes blocked with solid particles. It is called the irrigation port. Once inserted and inflated, the retention balloon retains the device inside the patient. It conforms to the rectal anatomy to create an effective seal and minimize leakage. Thanks to an innovative technology, minimal pressure is needed to inflate the balloon. This minimizes the risk of rectal tissue damage. Therefore, the balloon does not require periodic deflation and reinflation, which helps to minimize nursing time. When properly positioned, the retention balloon also helps to minimize the risk of sphincter damage and loss of sphincter tone. The soft, flexible silicone catheter provides an effective diversion of stool away from the patient to minimize the risk of skin breakdown, fecal contamination, and spread of infection. The disposable collection bag with an integrated cap and non-return valve further helps to minimize the risk of spreading infection. This provides effective odor control and completes this closed system. Let's review the steps involved in using FlexiSeal FMS. First, we'll discuss what needs to be done before inserting the device. Next, we'll cover how to insert the device. Then we'll talk about how to ensure its proper functioning. And finally, we'll review how to remove the device. In addition to the device kit, you will need gloves and a lubricant. You should perform a digital rectal exam to ensure that there is no fecal impaction. When removing the device from the packaging, check to see if there is any air in the balloon. If so, remove the air by using the syringe. Next, fill the syringe with 45 milliliters of tap water or saline and attach it to the inflation port. Position the patient in a left side lying position. If this is impossible, you may determine an alternative position enabling access to the rectum. Securely snap the collection bag to the connector at the end of the catheter. Then unfold the length of the catheter to lie flat on the bed. Extend the collection bag connector towards the foot of the bed alongside of the patient. The retention balloon has a finger cuff that is designed to facilitate the insertion. To make it easier to insert and remove your finger from the finger cuff, you should coat your gloved insertion finger with a lubricating jelly. You can locate the finger cuff by moving your finger along the irrigation line, starting from the irrigation port up to the balloon. Then insert your gloved insertion finger into the cuff. Roll the balloon end of the catheter in lubricating jelly so that it is well coated, and then smooth the jelly evenly for ease of insertion. Using your finger in the pocket of the balloon, gently insert the balloon through the anal sphincter until the balloon is beyond the external orifice and well inside the rectal vault. Then remove your finger. Inflate the balloon with 45 milliliters of water or saline by slowly depressing the syringe plunger. The inflation indication chamber on the inflation port will expand as fluid is injected. This normal expansion should subside once the plunger stops. If the inflation indication chamber remains excessively expanded after the plunger stops, the balloon is not properly inflating. This is likely the result of improper balloon positioning in the rectal vault. In this case, use the syringe to withdraw the fluid from the balloon, reposition the balloon in the rectal vault, and reinflate the balloon. Next, remove the syringe from the inflation port and gently pull on the catheter to ensure that the balloon is properly positioned. This will also ensure that the stool will flow into the catheter instead of around it. Then position the length of the flexible silicone catheter along the patient's leg, avoiding kinks and obstruction. Reposition the patient on his back, and position the catheter between the legs, so there is no compression or twisting. Hang the bag by the strap at a convenient location on the bed. Take note of the position indicator line relative to the patient's anus. You should observe changes in the location of the position indicator line as a means to determine movement of the retention balloon in the patient's rectum. This may indicate the need for the balloon or device to be repositioned. If the position indicator line moves up, that means closer to the anus, this may indicate that there is a need to gently pull the catheter to bring the balloon where it should be. If the position indicator line moves down, that is away from the anus, this may indicate that the balloon may expel. In such cases, the balloon should be deflated, removed, reinserted, and reinflated. If leakage occurs, this may be a sign that the retention balloon needs to be repositioned. However, small amounts of moisture or seepage around the catheter can be anticipated. For this reason, it is recommended that you use a bed pad at all times. Patients with very weak sphincter muscles may not be able to hold the device in place and may experience increased leakage of stool. If the silicone catheter becomes blocked with solid particles, it can be rinsed by filling the syringe with tap water, attaching the syringe to the irrigation port, and depressing the plunger. You should repeat the procedure as often as necessary to maintain proper functioning of the device. Flushing the device as described is an optional procedure for use only when needed to maintain the unobstructed flow of stool into the collection bag. Periodically, you may want to milk the catheter to facilitate the flow. Before changing the collection bag, it's a good idea to put on non-sterile gloves. To begin the bag changing process, rest the adapter flange on its side on a protective bed pad. Also, make sure you have a replacement collection bag within close reach. Carefully unsnap the soiled pouch and securely snap the cap to the opening to contain the stool. Snap the clean pouch to the adapter flange and reposition the unit to the location where gravity drainage has worked the best. There are 3 collection bags in the kit, and additional bags can be ordered separately. Snap the cap onto each used bag and discard according to institutional protocol for disposal of medical waste. Observe the device regularly for obstructions from kinks, solid fecal particles, or external pressure. To remove the catheter from the rectum, reposition the patient in a left side lying position and deflate the retention balloon by attaching the syringe to the inflation port and slowly withdrawing all water from the balloon. Disconnect the syringe and discard. Grasp the catheter as close to the patient as possible and slowly slide it out of the anus. Dispose of the device in accordance with institutional protocol for disposal of medical waste.
Thank you for joining me for this introduction to the FlexiSeal Fecal Management System. I hope you found this session helpful in learning how to use FlexiSeal FMS. With FlexiSeal FMS, you will be armed with an effective tool designed with safety in mind to manage fecal incontinence.